Hello everyone. In today's video, I will be talking about a molecule which is not very new, but the use of it would be new. The thing is, the drug is or the molecule was existing, but recently it has been launched for the treatment of COVID-19. And as an adjunctive treatment or as an emergency adjunct, it has been launched. So I'll be talking about 2DG, that is 2-deoxy-D-glucose, or otherwise also called as 2-deoxyglucose. They are one and the same. And these are nothing but they are glucose congener. Glucose or D-glucose congener. We all know that glucose exists naturally in the form of D-glucose, not L-glucose. D-glucose. And L-glucose is synthetically produced, which is of lesser significance. Now, the term glucose has come from the French word. It's a French word, and the word is glucose, the meaning of which is sweet. From there it has been derived, that glucose. Now, we have a few facts over here which I now want to tell you, is that the very molecule, that 2DG was approved by DCGI, which is a regulatory body of India, on May 8, 2021 for adjunct therapy in COVID-19. And on May 17, 2021, the drug was launched. Now, who has made this drug? Who has made this molecule for the treatment of COVID-19? It is DRDO. There is a lab of a DRDO known as INMAS, Institute of Nuclear Medicine and Allied Sciences. The lab of DRDO, this has made this 2DG molecule, and it is collaborated with Dr. Reddy's for the commercial production of the drug. Now, the DCGI has approved this 2DG or 2-deoxy-D-glucose for the as an emergency adjunct. This is not the drug for the treatment of COVID-19, but it would be given as an adjunctive therapy, that means in addition to the ongoing treatment protocol of COVID-19. So, structure wise, if you'll see how it differs with glucose or D-glucose, it is like that. We have this as a glucose molecule or dextroglucose, which the formula for which is C6H12O6, and D-glucose or 2D-glucose means deoxyglucose, means one oxygen is withdrawn, and this oxygen is withdrawn from here. So if you will see the difference, you will find that there is no oxygen at this place. So this is 2-deoxyglucose having the formula C6H12O5. Now, not much is known about the mechanism of 2DG for COVID-19. Now, this is a well-established diagnostic drug or molecule, or for drug for the treatment in few cancers. But how exactly it works for COVID-19 as an adjunct drug, we do not know, as there is scarcity of the literature regarding the same. But as the mechanism of 2DG acts for that cancer treatment or diagnosis of cancerous cell, the same is hypothesized to be applicable for COVID-19. The basic thing is that it reduces the oxygen requirement, and that is why it is said that this is effective only on those COVID-19 patients who are moderately or severely ill and they are oxygen dependent. That means who has to be given oxygen from outside, it will be effective in those. Means the oxygen requirement by the cell or by the body of those people would be decreased, and that's why it would be effective. Now, As the exact mechanism is not known in the case of COVID-19, I will discuss how it works in cancer cell. Okay. So we have here glucose, and glucose is transported across the cell, inside the cell, via facilitated diffusion and active transport. Now facilitated diffusion is through GLUT1 and 4, and activated transport is through SGLT, sodium glucose transporter. Now we have this transporter on the membrane, and from here there is entry of glucose via facilitated diffusion through GLUT1 and 4. Now it gets inside, in normal scenario I am saying about, glucose gets inside and it gets converted to D-glucose 6-phosphate. Glucose is a D-glucose, right? Because naturally it occurs in this form. So this gets converted to D-glucose 6-phosphate. Now this D-glucose 6-phosphate gets isomerized and converted to fructose 6-phosphate. Now this fructose 6-phosphate goes under multiple conversion, and finally it gets converted to pyruvate. Now pyruvate goes to the TCA cycle to produce some ATP. ATP is a energy. And this energy is utilized for the growth of cell, or the division of the cell, or the growth of the cell, and that is how the cancerous cells grow, by utilizing the glucose. Now what happens when 2DG is given? We'll see. 2DG will compete for the glucose transport, means it will go through the same transporter. Okay? So through this same channel. So here we will see that we will assume that this is also this GLUT transporter. Now 2DG goes in place of glucose. Now 2DG will go. Okay, it will go here. Now this gets converted to 2D D-glucose 6-phosphate, 2D D-glucose 6-phosphate, and from here the isomerization, further isomerization will not happen. This will be blocked by this drug. So there would be accumulation of this molecule. This would be trapped inside, or this would be not further converted to other metabolites, and that's why glycolysis process will be stopped. And this happens why? Because there is a missing OH group, and that is why this is trapped inside. So there won't be conversion, further conversion, glycolysis will be stopped, no ATP generation, so the cell will not get the energy, required energy. So this can be applicable for the COVID case also, cell infected by virus. Now virus would be utilizing the cellular ATP, right? Cellular energy it would be requiring for the growth and multiplication. Now when the cell is not able to generate ATP, that means virus will not get that energy and it will not replicate, right? It will not multiply. So this is the hypothetical mechanism. Few more point I need to say, that 2DG, as I have already mentioned, this compete for the transporter, that is the glucose transporter, which is GLUT1 or 4. In case of when there is oxygen decrease, there is a requirement of more oxygen, or when the oxygen is reduced, then there is overexpression of this transporter, GLUT transporter. There is overexpression. There would be many GLUT transporter which comes on the membrane, and because of that more of 2DG molecule will go inside and glycolysis process will be stopped because of accumulation of 2D D-glucose 6-phosphate, which I have already explained. Now what happened in normoxia and hypoxia? This is said that people who have hypoxia, there only it will be effective. Then why? We will see this. See, glycolysis would be more decreased when there is more hypoxia. In case of normoxia, ATP production can still be possible via other route, not via this route. Okay, so in normoxia, if we give 2D glucose, that means this glycolysis process would be inhibited, but still cell would be in the state of getting ATP produced from amino acid and fatty acid. But same is not applicable when the person is having hypoxia. It will be entirely dependent upon this, the production of ATP from this process, which gets inhibited when we give 2D-DG. Okay. This has the 2D deoxy molecule has the well-established diagnostic use. It is given as a radioisotope in the form of 18FDG. Fluoro molecule is attached with deoxyglucose. Now, it helps in detection, staging, monitoring, and recurrence. This molecule is converted to FDG phosphate, and that gets accumulated in the cancerous cell only. Only in the cancerous cell it gets accumulated, and that is studied or analyzed by the machine, that how many cancerous cells or what extent of cancer is there in the body. As it can easily penetrate blood-brain barrier, so it is very much useful for detecting, staging, monitoring, or recurrence of brain tumor. So this was all about 2DG molecule for the treatment of COVID-19, as well as few information on how it works in the cancerous cell. Hope it was a useful video. Thank you.